This webinar will be moderated by Sophia Hussein, who's the Director of Policy at John Howard Society of Ontario, and she'll be introducing herself shortly. But before we get started with things, I'd just like to go over some housekeeping items. So obviously the webinar is beginning now at noon and will conclude at 1:30 p.m. We'll be enabling the chat box so that you can leave comments in there and engage with one another. However, what we do ask is that you actually use the Q&A box when you have questions, and we're going to dedicate a portion of for questions at the end of the webinar. So please feel free to put your questions in there throughout, and we will get to them at the end. The webinar is being recorded today, and the recording alongside the slides and any resources will be emailed to all of the attendees following the webinar. And it will also be posted to the HSJCC's YouTube page as well as our website. And we'll also hold a few minutes at the end of the webinar just to send you a short survey. We want to hear your feedback from today's session. We're always trying to improve how we deliver our webinars across the network. So we greatly appreciate your feedback on that. And we'll also include the survey as part of the follow-up email in the webinar. And I think Ali's going to put the survey link in the chat for you. But just quickly, for those that are new maybe to the HSJCC network, the Human Services and Justice Coordinating Committee network is comprised of 38 local committees, 14 regional committees, and 1 provincial committee. Each of them is a voluntary collaboration between the Human Services, Health, and justice sectors, and includes many partners, including Crown attorneys, judges, police services, correctional service providers, community mental health and addiction organizations, developmental support organizations. And if you want to learn more about the HSJCC network, we encourage you to visit our website, where we have a lot of resources. And I believe Ali will be putting that in the chat for us as well. So now that we've wrapped up all of our housekeeping, it gives me great pleasure to introduce to you our first speaker and moderator for the session, Sophia Hussein. Over to you, Sophia.
Thanks so much, Candace. So happy to be here and to see everybody joining. These numbers are amazing. So I wanted to introduce myself, and then we can kick it off with Whitney. So for those who may not be familiar, the John Howard Society of Ontario is a provincial nonprofit organization dedicated to addressing issues within the criminal justice system, focusing on prevention, reintegration, and systemic change. We conduct applied research, policy development, program evaluation, and public education. And we work closely with and support the 19 JHS local offices that provide services and programs across the province. This topic that we're talking about today around housing is super pertinent to our work. We've long researched and proposed recommendations to promote better housing outcomes for people involved in the correctional system. We recently wrapped up a 2-part project on the subject. So the first part of the project culminated in a report called No Fixed Address, which analyzed over 10 years worth of data on admissions to Ontario correctional facilities of individuals who reported having no fixed address, meaning no stable permanent address, at the time of admissions. Findings from the report highlighted that Ontario's provincial correctional facilities are incarcerating a proportionally larger number of people experiencing homelessness now than at any other point in the last 15 years. As a second part to that project, we released a report entitled Locked Up, Locked Out that outlined findings from consultations with key experts across the province. And we did interviews and surveys, 123 surveys and 52 interviews with people with lived experience. And we sought to ground the provincial admissions data from the first report in the qualitative lived experience of people who have endured homelessness and the correctional system, to understand the unique issues they had in navigating the housing market and identify solutions that could improve those outcomes and address some of those issues. Some of the key findings one was that 41% of the 175 individuals that were consulted reported that their most recent housing loss had been caused by justice involvement. And once unhoused, many found themselves caught in a cycle of being reincarcerated due to homelessness and being released from jail into homelessness. And another key finding was barriers experienced by individuals when trying to access essential services in the community. Individuals with experiences of homelessness and incarceration often have various acute needs but due to things like wait lists, transportation challenges, and stigmatization, they often found it really difficult to get the wraparound support they need. And I think that is a perfect segue to our discussion today. The Housing and Homelessness Help Hub, or H4, among many other things, it brings together agencies in one location, making it easier for people to access the wraparound supports that they so desperately need. So I'm so happy to be here in conversation with Whitney Kitchen to discuss H4, the program's successes, and what we can learn from it to adopt in our communities across the province. So let's start. Whitney, can you tell us a little bit about H4?
Yes, absolutely. Thanks everyone for coming and thanks for the introduction. I have geeked out on the John Howard, like the PDFs that you guys have published and the research for so long, and it's a lot of the work that really justifies what we're putting together at H4. So excited that the two of us can kind of like intersect and bounce off each other because the work definitely interplays. But I'm gonna walk you guys through H4. And I'd like to start by acknowledging that H4 is operated on the ancestral territory of the Three Fires Confederacy of the First Nations, comprised of the Ojibwe, the Odawa, and the Potawatomi peoples. Um, so this is a picture of where H4 is, and I spent my morning there, and it's directly behind me in Windsor, Ontario. We are H4. I also call it Waterworld. If you hear us say the two things are the same because we're operating out of an old aquatic center, which you see in the bottom right corner. We still have the water slide to prove it. So it's part of the charm of the building and us fitting a square peg in a round hole for trying to find services for this population and making every space count. But H4, the Homelessness and Housing Help Hub, we're located in downtown Windsor, Ontario, and we have been open for the since last May from 8 a.m. until midnight. Previously, we were open just until 6 p.m., but we've extended our hours till midnight as of May of 2024 and have seen a huge uptick in the population really adopting the space as their own. And in January of this year, we just started operating to be 24/7. So now we are essentially operating a warming center, so people never have to leave, and we do serve 3 meals on site. We are servicing 150 unique people per day. And in Windsor, Ontario, we have 942 households on the by names prioritized list as of December 2024. So I just want to highlight that households could be representing families. So it could be 3 people that represent one household or a couple that represents one household. So it's not 942 individuals that are experiencing homelessness. Additionally, the location is situated directly in our largest concentration of rent geared to income properties that are single bedroom. So we have 3 apartment towers that are surrounding the Glengarry neighborhood and the Waterworld H4 building, which has long been regarded as an informal justice shelter. Prior to my work at the municipality, I have worked as a release from custody worker, and many people who I supported getting out of detention facilities were spending time in the Glengarry neighborhood and around in the rent geared to income properties, but were not necessarily tenants. So our H4, like I said, it's a square peg in a round hole. We are operating out of an aquatic center, and we have tried to find every inch of functional space that we can. Originally, we started with just utilizing the gym, which you'll see on the far left. And I was here the day that we first opened, which was in April of 2000. It was a response to the COVID-19 pandemic, and it was social distancing for people experiencing homelessness. Since then, utilizing the evaluation process, we've been able to really layer on significant services to be able to help this incredibly marginalized population. So we do have mental health and addiction supports on site. We have mental health supports that are on site in the evening hours as well. So from 4 till 12, we have a mental health nurse and we have a mental health counselor that's able to engage with the guests. It's not an appointment-based system. You just come and you mingle and chat as needed. We do have primary care. So we are blessed to have a partnership called Shelter Health, which is operating out of our 3 emergency shelters in the Windsor core. additionally operating at H4. So it's a combination of doctors and nurses that are providing wound care, physical health and mental health medications to folks that are within this population, and it is accessible without a health card. And the statistics that I got for how many people saw our entire shelter health system in December of 2024 was over 700 people. We do have housing assistance. So we have the program is primarily funded by MMAH dollars, and it is run by an agency called Housing Information Services, which is contracted from the municipality. We do have income supports on site, Ontario Works, that is available for people to get reconnected to their programming, but also so that they don't lose their benefits, which is really important. So individuals also don't lose their medical benefits and drug coverage. We have Indigenous cultural supports that are on site. I'll talk a bit about our justice partnerships in a second. We do have showers and clothing. Our entire pool deck is filled with clothing donations, and we offer 3 meals a day with rest spaces and access to computers. I was telling the folks on the call before that we also do therapeutic programming. So people did cookie decorating. We have Know Your Rights trivia, so people understand their rights for housing and their rights for interacting with the police. And we've had karaoke, barbecues. We have therapeutic dogs that come in for the folks, and we do run special days for bereavement when we are celebrating people who've passed in our community. So we've used the evaluation process to really grow this program, and we've utilized org code consulting to understand better who are we servicing and how can we make our services better fit the population. And the evaluation process has also helped shape our understanding of how many folks we have that are justice involved. But some of our preliminary data that came back was that we had an 82% male population we were servicing with the average age of 42. Over a third of the participants had never had a lease in their name, and the average length of homelessness was 36 months. The comorbidities or quad morbidities for people that are experiencing mental health and addiction were really pressing numbers to see. So 64% were reporting a serious mental illness, 77% reporting substance use, 32% reported a chronic health issue, and 36% reported a brain injury. We wanted to probe more and understand how many folks were justice involved, myself being a release from custody worker for 8 years, and being in the environment, I recognized a lot of the names and the faces, and we know from the beautiful work that John Howard has done about the intersections between homelessness and incarceration and how bidirectional it is. So we wanted to understand how many people are we seeing in our community that are justice involved. And this was our data as of June of last year, that 76% had an encounter with the police over the last 6 months, and 78% were actively on probation or parole. 86% had been incarcerated at some point in their lifetime, and 42% had been incarcerated within the previous 6 months. The justice partnerships are more recent to the service that we've layered on in recognition of the high crossover between the two populations of justice-involved homelessness. So we're proud to say that we have the John Howard Society on site offering the bail verification program. In our local community, the bail sign-in was approximately a 30-minute walk out of the downtown core. So we have them attend 1 half day a week, and they are now also attending one of our other homelessness sites, which has 140 people that get serviced on site there a day as well. They have been seeing between 5 and 7 people a week, which results in 5 to 7 fewer breaches submitted to the Windsor Police for failure to report. This is really important because it keeps people in the community while they're navigating their court matters, because we know that 80% of people in provincial custody at any time are pre-sentence and they're there on remand. Also that people that are in pre-sentence custody on remand are likely to stay there for over 60 days, which is a significant amount of time and just enough time to lose your housing if you're on social assistance. We have probation and parole from the provincial system that's there 2 half days a week. They've engaged with over 250 clients at age 4 within their first 18 months on site. And we are not a formal reporting center, but when people miss their probation, which is a 1 hour walk out of our downtown core, then people are able to get a next report date. So let's say I had probation on Monday and I missed it. And on Thursday, the probation office is there at H4. I can touch base with that probation officer, even though they may not be my designated person, and I'll be given the opportunity to attend the actual reporting office with more grace, and I'll be saving myself a breach for missing that first appointment. We have daily court lists that are monitored by MSW students. So they stand at the front with reception with the court dates open and are asking people if they remember that they have a court date. Are they connected to their lawyer? Do they need a phone call to the court system? Connecting them to duty counsel and other resources as needed. People will often come up with other questions, like talk about how they may have a need to get their DNA taken at the police station, and they're curious about what that looks like. And we are going to be adding some therapeutic video courts. We're having meetings with our local chief justices and the Crown's office to understand how we can better provide support to the individuals at H4. So in February of this year, we're going to be providing direct links into the video court system. So we're still in the networking process of that, but hopefully by the next time I present about H4, we'll have some great data for you about that. We have a community justice coordinator in our community who works out of the Crown's office, and their goal is to screen people for offenses that may be possible for diversion. If we have individuals at H4 who are presently on bail and have committed a lower level offense and they obtain housing while they're on bail, we submit documentation to the CJC coordinator who's able to advocate for them to have a therapeutic community sentence and as an effort to have them not return to homelessness and lose their housing placement for a short stay of incarceration. Lastly, we have partnerships with the Southwest Detention Center. Southwest Detention can message myself if they have any concerns about a person who's going to be released from custody who's potentially banned from the shelter system. And that's something that we can evaluate. We recognize that sometimes people receive shelter bans for behavior that's related to being unmedicated for a mental health concern or related to addiction or withdrawal related behavior. And if that is mitigated for a period of incarceration or even hospitalization, because we have a partnership with them as well, then that's something that we can mitigate when they're getting released from custody, and we'll make sure that there's a landing place for them. So yeah, that's the little snippet of H4, and I think that we're going to start a conversation to talk a little bit more about things, but I'll throw it back to you.
This is amazing. It's so great to hear about everything that H4 has to offer. And it sounds like it's grown. It hasn't been around for that long, relatively not that long, but it seems to have really grown in that short time. Can you walk us through how the program has evolved since its original inception?
Yeah, definitely. Like originally it was just a social distancing center for folks experiencing homelessness. We had granola bars and water bottles, and we didn't have anything else really to offer. And that through seeing the need with the population grow, we've been able to layer on 3 meals. We've been able to layer on 13 service providers and expand the hours. So it was strictly day services. Then we moved to 16 hours a day, and now we're operating 24 hours a day for the winter because we needed additional shelter capacity space. So that's a significant change. Additionally, we didn't have the 2 health centers as well. So we do have those 2 full medical clinics that are operating at the back that are part of the Shelter Health Partnership, which is between a local group of doctors, Canadian Mental Health Association, and the Windsor Regional Hospital. But like one of the big wins for the justice population there is that we have a doctor who is also trained in addiction medicine, who works part of the time at the Southwest Detention Center, that also works at our H4 location. So there's a lot of continuity between what your medical needs would look like when you're in custody to when you're transitioning to the community.
And speaking of that, can you tell us a little bit more about the kind of needs that people have, those that are coming to access the services? What are you typically seeing?
Yeah, I think you'd mentioned some of the needs at the beginning, like, and some of the barriers. So some of like the needs that we're meeting, people's basic needs, like need for food, clothing, access to technology like computers and telephones, things like that. We're taking care of those pieces and also connections to services because wait lists are an extreme challenge. And I think it was in one of your guys' latest reports, it was cited as like a big reason for why people are struggling to get reacclimated when they're getting out of custody. But some of the additional barriers that we're still trying to work through is lack of identification. We're trying to get an ID clinic in there part-time. So when people don't have their medications, their identification is also really important and able to get that. When people are going to our health clinic, if they need more testing, if they need blood work, they need ID or an OHIP card in order to be able to access those. So that's a real challenge. So we're really working on streamlining that process. But some of the other barriers is just how inaccessible and how unaffordable housing is right now. Like I think rent's gone up by 2.3% per year in the last decade, and social assistance rates have not made any meaningful change. So it is really challenging for people to find affordable units. So the reliance on services like this are so much more pressing. Um, I think also, I know it's not just in the Windsor community, it's more, this is true of within the province. There are a lot of places that have kind of closed their doors for folks that are experiencing homelessness. And we've seen dining rooms close down and public spaces that were maybe more accepting of homelessness and visible poverty previously becoming less tolerant, which is putting more pressure on homelessness serving systems to have more capacity to accommodate the population. Another significant challenge, which we see playing out in public policy as well, is that there's no place for people to use substances. And that's something that we see a lot in our population. By no means do I want to conflate homelessness and substance use and justice, because there's a lot of people that are sober and there's a lot of people that are not using substances. But we do have a complex population at age 4 with a lot of medical needs and substance use as well. And there is no safe place for people to use substances or for them to be operating from a place of intoxication. So the changes to safe consumption sites and the upcoming changes with the Safer Municipalities Act with encampments and public consumption outside are things that we're, considering how H4 impacts that. But I think that wait lists and stigma, I think like John Howard references the triple stigma of justice involvement, homelessness, and being on social assistance. And that's a significant barrier to housing and to accessing services in general.
Absolutely. And we've heard even in consultations through accessing healthcare, like trying to access
Mhm.
healthcare, trying to get supports, there's that stigma of being unhoused or having other substance use issues that's preventing access to care. So I think it's great that your program has that wraparound supports and really making sure people have the support they need from somebody who understands. Can you talk about, there's clearly so many successes that you've managed to achieve. Can you talk a little bit about your success rates and a little bit about how you measure success? I think with this industry, it's not just about getting people into homes. As you mentioned, there's challenges around affordability and other things out of your control. But how do you measure success and can you share some success stories?
Most definitely. So I'll say last year, as a response to winter homelessness, we had a warming bus that we started. And during that time, I was one of the staff that I helped implement the warming bus, but I also helped staff it. And it left out of H4. And I became very connected to this gentleman who had schizophrenia, who had been sleeping outside. And today, when I went to H4, he's getting his keys to his place today. And I don't know if any of you have been outside today, but it's like one of the coldest days. It's -10, but it feels even colder in Windsor. So to hear that he's getting housed today and is having a mattress delivered and checking in is a really amazing top of mind success for when I'm thinking about the program. But
Mhm.
I do think that we need to be cautious about how we view success. And because I've been in justice for a while, I've always viewed success as engagement because it is really challenging to reprogram years of people's behaviors that are informed from their trauma and making sure that people have equity to accessing resources that are going to make that meaningful change. So at H4, engagement is our #1 metric of success. If people are coming back and they're utilizing the service and they're evaluating the service highly as something they value, we view that as a success. We have been able to house a considerable amount of people. And in 2023, we housed 123 individuals. So that's proving that you can still house people within the social assistance rates that are operating, but we do have a considerable amount of people returning to homelessness. So from 2020 to 2023, H4 recorded a 35% return to homelessness rate, which really speaks to the complexity of the population and the fact that our post-housing support was not at the layer that we wanted it to be in order to help sustain those housing placements. There is a lot of complexity in the population, and despite us doing social skills teaching about like building norms if you're moving into an apartment and how to maintain your housing, there's a lot of hours in the day where a housing placement can go wrong, even with follow-up support. So I know that some supportive housing programs that have scattered site placements, you might get 5 hours of support a week or less, but there's still so many hours in a day for something to fall apart. And that's something that we've noticed. And our program is really stressing the need for high support housing for justice-involved individuals and for folks experiencing homelessness and complex mental health, because we recognize that that is a permanent solution rather than building more shelter spaces. But when it comes to determining success, I think that it's really important that we determine it more broadly than people not engaging in recidivism or returning to custody or people not returning to homelessness, because that is an extremely high burden and threshold, like I said, for people's trauma-informed behaviors. And it really is something that we need to be mindful of to protect the mindset of our frontline staff that are working with folks that may feel like I'm never successful with the folks I'm working with because things keep falling through. And it's a really hard job to support individuals in this population with the resources that we presently have.
Absolutely. And I think engagement, the way you put it, engagement is such a success. Just having somebody to maybe build that trust and rapport with and having somebody feel like they want to come back is such a major thing in itself. And so that should be celebrated. Can you talk about some of the challenges to getting H4 up and running? And maybe related to that, I think a lot of people are always curious about how like the broader community has responded to H4. It's in a recreational center or a converted recreational center. Can you talk a little bit about how the community has responded to it and if there were other challenges with getting it up and running?
Yeah, I think that one of the main challenges getting it up and running was that it was originally funded by COVID investments, which were getting released quarterly, so SSRF investments. So we've now thankfully had a significant municipal contribution in keeping the building having sustained funding, as well as marrying it with federal reaching home dollars. We do have in-kind staffing as well from some of the other sector support. So like the municipality does not pay for our legal and justice support. Those are just folks that are coming in kind, recognizing that it targets the population they're trying to meet anyhow. We also had significant challenges engaging the health sector, which, you know, on the heels of the pandemic was already really challenged and stretched pretty thin and could be servicing an easier cohort of like the population with their limited resources as well. So thankfully, we now have engagement there. And I think that there is, there's mixed feelings about how the service, how like the public has adopted the service. Naturally, like we are well positioned in the community. We are in a neighborhood that has geared to income support. So that is something that there are other folks in that neighborhood who've come to access services and who've benefited from the staff being on site. We really try to protect the community from like any harms of having the program on site. So I would say it's had mixed reactions with the level of NIMBYism that you could expect. But thankfully we didn't have time to engage in the consultation process during the pandemic because it was an immediate response that was required to get a space open for social distancing. So we didn't have to navigate that challenging consultative process in the community, which is really there's no ideal place for a service for clients with high and complex needs in terms of the eyes of the community.
Yeah, absolutely. And you mentioned, trying to get new services and sectors involved, like healthcare. How do you build those relationships? What has been what's worked for you so far in expanding what kind of services are able to join H4?
What's worked for us is a few things. One, we've been really lucky that our health system is pretty dialed into the work that we're doing here in homelessness, and we try to assist in the ways that we can to the other sectors that we're requesting feedback from. So we try and have like you scratch our back, we'll scratch yours, mutually beneficial partnerships. So we have a protocol established with the Windsor Regional Hospital. So if anyone who's going into the hospital is admitted and they're at risk of experiencing homelessness at discharge, or they are homeless at discharge, they can contact myself or my colleague Kelly Gause, and we can do a case plan to understand if there's a supportive housing placement within the supportive housing spaces that are supported by the city, that we could maybe put that person in, or if there is a best approach within the shelter system, if we can layer on our outreach team, what are some additional ways that we can support to sustain that tenancy? Maybe it's paying housing arrears. So we are working with them to manage that. Additionally, we participate in a frequent emergency department users table where we're trying to find housing solutions for folks that are chronically in the emergency room. And we did target key performance indicators that we knew benefited the mental health sector to get some additional buy-in for their engagement at H4.
That's great. And we know a lot of people who are, struggling, dealing with homelessness. It's often emergency rooms, corrections, all of these different points that they end up sort of falling through the cracks and landing in. So it's great to see support in all those different areas. Can you talk a little bit, and this is sort of related, about what local conditions or needs make this approach appropriate? So in other words, if communities are thinking about whether H4, this model could be useful in their community, what are external factors or community needs that would potentially foster success with this model versus other approaches?
Yeah, I think that the one thing that we've been told in feedback as we've been presenting about H4 is that like more municipalities are starting to become engaged in justice work. And I do think that when we look at the statistics of, the rates of homelessness in our country and in our province, there was just some great data released about the state of homelessness in Ontario, that we are like homelessness and justice involvement is bidirectional, and naturally the synergies are there for the municipality to be engaged in a meaningful way with local detention centers to try to grow services so that we can reduce the complexity of homelessness. So we've already seen a huge push in other communities to be involved in the health sector. And I think that justice is just the next iteration of recognizing that it's a complexity that can be tackled locally at the municipal level in partnership with justice and health agencies in order to make a difference. So I actually don't think that there's anything unique about the Windsor landscape in relation to like how we got H4 started or how it solves a unique problem in our community. I think that this is something that could easily be replicated in other communities and should be based on the successes that we've seen. We have a local remand center here in the provincial system, Southwest Detention, that holds approximately 315 people. But right now we know with provincial custody rates that it's actually seeing more people than that because the provincial custody system is over 100% capacity, much like our emergency shelter system. So if we know that roughly 20% of the population in custody at any time is experiencing homelessness, those are a lot of people that are going to be trickling between those systems of hospital, incarceration, and emergency shelters. So I think that this is something that's easily replicated throughout other communities if there's partnerships established and a willingness between the players at the table.
Yeah, and as you pointed out too, it can grow. Like it started
Yeah.
off sort of smaller and you put together what you can, and then this grows as you get more funding opportunities, more partnerships build. So it seems like there's an opportunity to customize it in that way as well.
Mhm.
That's great. We've talked a lot about what's working great, what's included in this model. What services are missing, in your opinion?
The service that I think that's missing is meaningful therapy. Um, there is, so it's interesting. Like we have people that are getting released from custody that are put into the emergency shelter system, which is like right now really feeling the weight of the opiate crisis. So we're having people that are already experiencing a huge amount of lifestyle trauma and trauma from their upbringing, which is why they're in the justice system to begin with. And then we're putting them into the biggest pressure cooker situation possible with people with active addiction and unmedicated mental health, challenging behaviors, experiencing poverty in a high density living environment. And a lot of our addictions resources, it's kind of all or nothing. So you have to really commit to sobriety, to go into a facility, to detox, to face everything in a sober context, or you have to attend group therapy to get meaningful trauma-informed therapy. So our community had actually filled out a grant application for folks to be getting dialectical behavior therapy on the streets. And we wanted to be teaching people about emotional regulation skills and how to recognize symptoms of trauma in their body and how that influences their behavior. So that we could be teaching that to people even in small snippets while we're doing these engagements with folks that are at encampments, with folks that are at age 4. Um, because that's such an important part of substance use reduction and how people are managing distress tolerance, and being homeless and being released from the justice system is a massive trauma. And it is incredibly stressful for people to try and reorient and get acclimated into the community again. So I think that trauma and grief and bereavement counseling are services that are missing. And we keep layering on system navigation and community tables, which have their value, but without additional resources to housing subsidies or the meaningful therapy that's actually going to change people's trauma-induced behaviors and help them process their past or their pain that's leading them to addiction, we're not really going to be moving things forward in a meaningful way. And I think with that therapy, we would really be, I think we would see an improvement in the housing retention for individuals that are perhaps on the cusp of having that independence and being able to live in that way. But naturally, the other service that's just missing from this cohort is provincial halfway houses and high support housing for individuals with significant comorbidities, with extreme mental health or brain injury, where they're not going to be able to live independently and they are just cycling between those systems.
I want to pick up on, talking about even bits of therapy that staff can do, and maybe a little bit of, get your thoughts on, sometimes it's this population dealing with all of these comorbidities and trauma and all of these challenges. You really need like highly skilled, supported staff to be able to respond to that. And can you talk a little bit about sort of how H4 has kind of managed that and what you'd like to see with that? What would be the ideal situation?
Yeah, ideally, well, it's great that we have a multidisciplinary team over there, that we do have people that come from a mental health lens and that we do have people with years of experience in the field. It is rare to capture people with years of experience in the homelessness serving field because, in terms of homelessness services, justice, and health, homelessness services have the lowest wages. So you see that to be largely a position with a lot of entry level staff that are cutting their teeth in the field, and then they're graduating onto positions that have higher pay. So ideally, we would be offering high levels of training to support this population because we have staff that are engaged with some of the highest behavioral needs and high risk clients that we're experiencing. So we would definitely like to be layering on more therapy services at H4 specifically. One thing that I think that we do really well is we have therapeutic pets on site, which are great for regulating nervous system and managing behavior. And we have opportunities for folks to speak to bereavement counselors, and we take a really responsible approach when folks in the community pass away so that we can check in with the population and ensure that we are doing our due diligence despite the fact that there's no real grief rituals within that community.
That's great. And you mentioned, you know, other housing that should be available, and that's something that's come up for us too in a lot of the consultations we do, the need for something like provincial halfway houses for transitional housing and then long-term housing for people that need it. But that a lot of, while they're great models that exist across the province, there's a lot of areas where people don't have anywhere to go when they get released from incarceration. And then, as we talked about, that just sets people into this vicious cycle that's really hard to escape from. Um, on that note, around expanding things you wish to see for H4, what other opportunities do you see for expanding H4, either its programming or reach?
Yeah, well, right now our site is always at capacity. So our space right now has 45 or 40 people that are staying there overnight. And our line out, there's a chronic line outside the program for people trying to get inside to access different services and to be out of the cold. We've moved our line inside the building so that people are warm during this weather, but our space is extremely challenged. So moving to a different site where we can have more intentionally purpose-built space would be ideal. We did engage in the consultative process with an architect and talked about the implementation of spaces with natural light, how great a central facing courtyard would be for privacy and for behavior reduction, and having that ancillary housing on site so that we can have high support housing, but also the suite of services in the medical clinic below, and potentially like 1 bedroom units on site. We've also talked about the potential of having housing pods, which we're seeing more communities invest in. It's just a necessary evil. Like, we don't recognize pods are not anyone's preference. We would prefer buildings and spaces that promote more dignity. But when we don't have a lot of options and when building housing is so expensive and it's pushing the problem further down the road, like pods are a good a good way to cut the time in half in order for you to get a space up and running. So that's something we've discussed as well. But the need for permanent housing solutions for this population on site that have already built the trust with the staff and that are invested in participating in the program, but require some permanent solutions is where we see this program growing to. And we have a pitch and business proposals in for us to have 64 units of high support housing for specific populations, including those with justice involvement.
Incredible. That'll be great. And we're going to take some questions from participants here, but to sort of wrap us up, can you talk a little bit about lessons that you've learned, what other folks who may want to sort of start this in their community should think about?
Yeah, I think that I was talking to my coworker about this, Kelly, yesterday because I wanted to make sure I captured her thoughts on it as well, because she really started this process while I was still working frontline at H4. But one of the biggest things is like to not be afraid to make mistakes and to build the plane and fly it at the same time. Like, we have to just get services started and they don't have to be perfect. And we have to get partnerships started and they don't have to be perfect. We can tweak them, we can adjust them based on the consultative process and what we're hearing from other community partners and the population. Or if we hear about a best practice that's happening down the 401, we'll implement it. Like, we're not afraid to pivot things to make more sense, but you just have to start because the homelessness crisis is only getting worse. And we need to have more services that are open. So that was the biggest thing for us. Additionally, having the municipality be comfortable shouldering some of the risk that's inherent with servicing this population, whether it comes to people that are using substances or people that are justice involved. We do not have a site that has metal detectors. We do not have a site with high police presence. Like there's no police stationed on site. They come and go within the community. But we really want this space to be oriented towards the needs of the population so that they can access it at the comfort level of feeling like it's their place. Staff, I think I mentioned to the team, staff are wearing beanies and casual clothes, and people that are participants in the program are bringing their pets into the site, and it's a space that's filled with a lot of community. And that's something that naturally is like a less controlled environment, but it's something that we really take pride in.
That's amazing. We have a few questions, and folks can continue to populate the Q&A chat with other questions as they come up, so we can go through some of those now. This is a question is a little bit related, but I think it speaks directly to certain partnerships. So the one question, Colleen is trying to expand their drop-in center for women and gender diverse folks in Hamilton and connect with justice services within the community. Is there any advice you'd have for programs just beginning to make connections with probation, parole, jail, courts, etc.? And how do you foster those relationships?
Yeah, so I don't shy away from the fact that because I had done release from custody and I had worked for our local Canadian mental health, I did have some of those relationships and connections in my back pocket when I joined the municipality. So I did have a slight cheat code. But I think that reaching out to probation and parole and talking about like what you're looking to start and how it can achieve mutual wins is something that hopefully they're as open to as our Windsor office was. For example, like probation and parole offices, like frequently you do have like your items are locked up and there is more control in those spaces. I can tell you that our local probation and parole attends H4 wearing jeans, and they meet people at a across from like a Canadian Tire folding table. And that's something that they've seen a lot of engagement in, and their probation officers have been competing to have that time slot to come and be the officers that work at H4 because they find so much value in understanding the multidisciplinary treatment plans that can be put in place. So when people go and they check in with probation, they're asking, what's the progress with your connection to mental health? What's the progress with your connection to housing? What's going on with your ODSP application? Well, now all those services are on site. So it makes supervision way easier. And you develop a different rapport when you're meeting in a space that's based on the client's needs, not based on the client necessarily going to you. So when you look at like the shared wins between our probation office, and I know that our folks at probation would be happy to speak to another community about the benefits that they've found in being on site. It's just finding a way that both people partner and are successful. For our jails and our courts, they were naturally on board, and we tagged into our existing mental health court system to work with the people within those structures that already have a mindset towards therapeutic alliances and community partnerships.
And it seems like it's helpful to have the experience of another location to be able to say, like, this is what's helpful, this is how it can benefit these other partners.
Mhm. Absolutely. I see Candace has her hand up.
Oh yeah, Candace, go ahead.
Sorry to interrupt, and I think that's really great advice, Whitney. I would just be remiss if I didn't do my little plug for the local HSJCC in your area, Colleen. So because there are so many service providers that come together between the health, human services, and justice sectors, I think that's a great opportunity to join that table, see who's already there, and start to make some of those relationships, because the whole purpose of that table is to break down silos and to find better ways to support folks with these needs. So if you're interested in getting involved, the Secretariat's happy to connect you that way to start to build those relationships as well.
Great. Okay, we have a few other questions here. So we have a question about how Windsor achieved the H4, the location. specifically, and get so many government and nonprofit departments and agencies involved. So what advice do you have for other communities that dream of having a similar location and program in place, especially with funding being on such a tight string?
Yeah, definitely. We got lucky, like I said, with the location. Windsor had closed this aquatic center to open a brand new one. And because it was previously running some rec and therapeutic programming and it did have a gym inside of it, but during COVID, all of that was closed. So our ability to take over and absorb programming there was pretty effortless. But it is a municipal asset, so that space is owned by the municipality, and we contract the services out to Housing Information Services, which runs the program with consultation with the municipality. So we are primarily funded, like I said, through federal Reaching Home dollars and municipal contributions. So it is funded through homelessness dollars. Um, We've been lucky that we've been able to just offer people space and to have really flexible service agreements. So we do have MOUs with many of our partners that come on site, but as the municipality, we're also the folks that are delivering Ontario work. So that makes income really easy to sneak in there. We are responsible for homelessness, so our homelessness dollars can go towards that program. We do fund the Can-Am Indigenous program that does cultural support on site. So they go. But then we've been blessed that these other partners have found the mutual benefit. So what we started doing was just inviting partners to come on site, saying, hey, like, why don't you come have a tour and keep an open mind? And we can show you our evaluation stats that highlights the demographics and the needs of the population. We can tell you how many people we're targeting per day and how we think this can also benefit the population that you're trying to serve that's maybe slipping through your fingers because of technology and barriers with leaving messages at shelters not being a super adequate way to connect with folks. Whereas we have people that are hanging out here all day that are waiting to get engaged with your services. So once we've had a service provider agree to come on site and spend time with us, none of them have decided to terminate that partnership. They either have reduced their hours or expanded their hours, but we've been able to retain all of the partnerships that have come out and decided to give our site a try. And there's no obligation. So they can come, they can lend a staff if their staffing needs change at their home site and they have to pivot, they can do so. But we've been lucky that the needs have continued to meet both what H4 is looking for to expand our programming and what community providers are hoping to service with tackling needs of this population.
That's great. There's a question about whether there's support for people with developmental disabilities at this time.
We don't have designated support for people with developmental disabilities on site as part of our regular staff cohort. We do offer trainings to the team on like how to recognize different disabilities and how to service folks with fetal alcohol disorder or folks with brain injury. And we recognize that this is also like a large cohort of the justice population that's underserved. We do have partnerships in our community with the folks that are providing those services and can do referrals and get them connected as needed, but we don't have any designated staff on site for that. We do have a partnership with Assisted Living Southwestern Ontario, which does provide some support to that cohort as well. And they have been on site to like talk to us about the needs of different people within that sector, but it isn't something that we regularly are having. It's not one of our core services.
And there was a question, and I'm just hoping for some clarification. It was about identifying the cohorts or a database being created by the city. I'm not sure if that question's related to whether how you identify clients or the cohorts, and whether there's sort of a database from the city that you identify folks to support, or if it's just sort of those who come through your doors. Maybe you can answer that, and for the individual who asked the question, if that's not what you were hoping to get at, please type it back into the chat.
Yeah, so whenever people are coming into any of our shelters or to H4. They're checking in with reception and they're getting, provided they sign a consent, otherwise they'll be tracked as anonymous, but most people do sign the consent. They're put into the system that we have called HIFIS. HIFIS is a federal requirement for us as a municipality to be tracking homelessness data. And we do have a data expert on our team that does all of our data analysis. So with that, we can track like reasons why people came into homelessness, demographic data, how long it's been since they've had an apartment. There is an opportunity to track incarceration as a reason why people are experiencing homelessness. We can see their acuity scores in terms of a VI SPDAT tool. And we can also see their placement on the by names prioritized list. So we do have this data, which is like operating in real time. And then in addition, when we do our consultative services, that's when we're hiring consultants to come in and like really take a snapshot of the program and understand who is using our services on site and what their specific needs are. And through interviews, qualitative and quantitative, and through focus groups, as opposed to just studying our database. So we're trying to capture things in multiple ways.
And are you hoping to sort of have that be an evaluation of the program to sort of show impact over the years, or is that a possibility?
Yeah, we have two public-facing evaluations of the H4 program that are available on the city's website. The most recent one was published in June of 2024, and that's the one that really highlights our justice partnerships and the statistics that I showed about how justice involved the population that we're servicing is. So yes, we are always wanting to make sure that we can prove that what we're doing is having the benefit to the community that we're hearing from the folks and that we're pulling from our database through independent sources.
I think that's those kind of reports are really helpful for others trying to initiate these kind of programs in their own communities to show the impact and establish to decision makers why these are so necessary and important. So that's great. Maybe we can link that or share that around if those are available.
Yep.
Okay, so it's another question here is that H4 sounds like a great fit for larger cities. Do you think this type of service could be applied to smaller communities? And if so, any ideas on how that would work? And I know you said this sort of isn't, this program isn't unique to Windsor community. It can be applicable to a lot of different areas, but can you speak to how it would maybe apply in a smaller context, smaller city context?
Yeah, that's a great question. And we actually have a perfect example of that. So within Windsor Essex County, there is another community that is like approximately 45 minutes to an hour of a drive away. And they do not have like the robust emergency shelter system that we have in Windsor. So the community is called Leamington. Leamington is home to a lot of migrant workers and they have significant housing challenges with affordable housing. And out there, the Essex County, we have an Essex County hub, which is run by the Essex County Department. So they have their own homelessness hub that's operating outside of another building. It's operating in an office space, and they have a smaller footprint but are also providing services that are typically offered, I believe it's through 8 and 6 p.m., where people can have housing search assistance, they can log into computers, they have a space where they can sleep if needed, and they are able to get some food and nutrition there and get some individual case management. They do have some ancillary support from, I believe, a legal clinic that's on site. And they're always adding different partnerships to pop in for a day or two. And over the winter, we fund them to operate a warming center as well. So they're operating an overnight center for folks that are experiencing homelessness. And we do have a good amount of people that are accessing services that are justice involved out there as well. So it is something that can be run in a smaller community. And if anyone wanted more info on that, I could get them connected with the Essex County Hub, which is running a smaller site in a smaller with a smaller footprint.
So here's a question and suggestion. Have you considered asking a medical school residency program if there are residents who may be able to Zoom in 3 hours per week to provide therapy? Um, and that, yeah, I think that's a really interesting one. There's something we were talking to some folks up in the north about how a lot of medical school programs don't really consider community health very often in residency programs, but that there's a growing push among some doctors to make sure that that's considered and that people have the opportunity to get experience. So I think that's a really cool question.
It is a good question. And we actually, like as a municipality, we invested in getting virtual therapy hours. So we partnered with, I believe it's Green Shield, that offered services through a database called Inkblot. And we had lots of hours dedicated for folks that were experiencing homelessness. We also provided it across our supportive housing sites and some of our RGI sites. And we did not have significant uptake despite the fact that we had the technology available for individuals at age 4. And we were trying to figure out what that reason was. And it was a couple things. It was people's access and comfortability navigating the tablets in order to get into the technology. So you had to create an email address and then you had to create a profile. And there was a couple of steps involved in it. But additionally, what we were hearing is they were like, well, I don't know that person. So there's something about the in-person rapport that we thought was something that was working better, that we want to deliver like more informal therapy supports. Like there's something to be said about like therapy when someone's like outside, taking a break from the program and you're just like walking with the staff and they're teaching you a skill without you knowing that you're having therapy. Because we were finding that these like formalized therapy appointments or more formal methods of engagement were not really capturing what the population was asking for. So we did give it a go to do the virtual therapy, but it just was not taken up by the population at the time.
Yeah, I think that's such a good point. We hear a lot about how important like recreational therapy can be because sometimes it's about like let's cook together and
Yes.
then, let's, talk a little bit, break down some walls, allow people to be able to open up and start to be more open to the services that are even available. So I think that's you mentioned wanting to include more of that and that's seems really appropriate as well. Um, okay, this is a question about your successes, and you talked about getting some folks into housing and an individual quite recently. How have you overcome the high market rent levels for those with limited income, such as OW or ODSP?
Yeah, just dedicated searching. Our community has not had like we don't have a huge bank of available rent supplements, and we've had challenges getting further allocations for those. So we just Windsor, Ontario is still slightly more affordable than other parts of the province in terms of like getting an apartment. So we have had some folks that are able to allocate larger portions of their check towards rent, and then the staff are supporting them with food banks and other donations in order to like make their household complete for the month. But those people, like we have some people that are only having $70 designated to them after they find their place. We've also been encouraging individuals to consider renting a place with a friend. At age 4, there's a tool for like roommate matching, so they can figure out if they have a compatible match with a friend. We aren't necessarily making those suggestions, but if two people say like we'd like to live together, we're able to sit down and talk to them about what those challenges of living together might look like. Do they have the same expectations for housing? And to try and make sure that that's going to be a compatible fit. Because at this stage, it's almost the way that you have to go with getting people to be able to afford units with the current housing market being what it is.
Are there any resources around tenant rights? Because I know a lot of folks are vulnerable to like rooming houses that don't
Yes.
necessarily respect tenant rights and being aware of those issues or having some sort of recourse if there are concerns.
We have a gigantic board of tenant rights actually that is always up, that is promoting what landlords can and can't ask you. What are your rights as a tenant? And like I said, we also have those events where it's like know your rights. So those focus on your rights with interacting with the police and your rights as a landlord renter relationship
Fantastic.
and teaching people how landlord tenant board works.
Yeah, that's a huge one.
Yeah.
That's great. Okay, here's a question from Dennis about services for seniors. So you mentioned that the average age you're working with is 48 years old. Do you take into account accelerated aging among the homelessness population or those experiencing incarceration, homelessness, compounding systems?
Most definitely. And I think that that's where our health partnerships are really coming into play with having the shelter health on site and them being able to navigate some of the complexities that are coming with having a seniors cohort in homelessness. And thankfully, we also have an extremely talented social worker on our team at the city who knows how to navigate like capacity assessments and long-term care evaluations and can get involved when we have high-risk seniors on site, whether it be one of our shelter providers or H4, in order to make sure that they aren't better served in another system and that they have the capacity and the resources to live independently. I think it is a significant challenge with how much older the population that's coming into homelessness is for a variety of factors, like fixed income and the affordability crisis being what it is. But our site does our best in order to navigate the challenges associated with seniors' needs. But one way that we've been extremely challenged is like we have a gigantic long hallway that people have to walk down in order to get back to the gym. And we have had several seniors that find that to be like a very onerous task just to get down there to meet with different staff. So we try and be as flexible with our space as we can. But servicing seniors in the homelessness system is just something that like, I don't think we should make the homelessness system meet the needs of seniors more so than we should expand seniors and health-based services for them because they are still incredibly vulnerable within the homelessness system to physical violence and exploitation and risk of people trying to take their checks and medications. It is really an extra concern for our entire homelessness serving system.
Absolutely. Okay, we have another question here pointing out the incredible gains that you've discussed, but can you talk a little bit about risks? So how have you dealt with individuals with significant behaviors, things like intoxication, et cetera? These days, it's a major concern, and sometimes even decision makers will put the brakes on certain initiatives if they think it will sort of impact those risks in community.
Most definitely. And I think that, so that's why I was talking about like the need for the municipality or whoever's running the site to be able to shoulder that risk. And we're lucky in the respect that the municipality is tasked to run the homelessness centers or like to fund them. So that risk is already inherent. They're a member of our community and it's someone that we need to find appropriate services for. That being said, we do have some service restrictions from people on site, and we do try to make them very therapeutic and to coordinate them with other existing services in our community. So there are some folks in our community that are banned from various shelter spaces, whether that's for violent assaults on staff or violent assaults on other guests on site. Intoxication can certainly play a challenging role in moderating behavior in those spaces. We do have individuals that we will put on supervision. So when they come to the door, one of our supervisors on site needs to go and perform like a bit of a assessment to see what their headspace is like, to see if they're agitated, to see if someone else is in the building who perhaps they have conflict with, and to make a strategy so that we can save everybody or service everybody safely. Um, but it is a challenge. It's a reality of, working with a cohort that is, really underserved in the realm of dealing with their trauma. And that there is behaviors that come alongside these lifestyles that they're living. But I will highlight, and I always reference this story, that last year our city ran for 55 nights a warming bus that operated from 10 p.m. until 6 a.m. And that bus was going around and we were picking up people who were service restricted, who had vulnerable mental health, and who were getting released from incarceration. We were picking people out of bus shelters who'd perhaps just used substances and people that had thought they wanted to sleep outside, but then throughout the night, they decided to change their tune because of the cold. And we operated that bus with 22 plus people on it at any given time. On average, we had 46 people a night. We had no security guards. It was myself or another one of the city staff, in addition to a staff member from our shelter system. And we had no major incidents of violence because people were appreciative of the service. And when people came on the service, we greeted them with, like, "Oh, we're so glad you're here." And we didn't give them a consent form and we didn't tell them all of the risks and liabilities and rules. And I really think that the way you treat people in a program and the way that you orient your services can be some of your best strategies in managing behavior and creating an environment that's safe for staff and peers, and that the participants want to protect because they value what it brings.
Absolutely. There's so many underserved needs and people are just experiencing um, issues that they need support with. Thank
Mhm.
you, Whitney. This is great. I wanted to give you a chance if there's anything that we haven't covered that you just wanted to share about H4 before we wrap up. Feel free to share that now.
I don't think there's anything else I want to necessarily say about H4, but just in the last question about speaking about risk, one of the things that people were also really concerned about was that we allow folks to bring their pets into the building. And we've had great success with that as well. We've had a couple of hiccups, but nothing significant. And I think that sometimes if you lean into the risk and you have appropriate staffing numbers and values and a team that's well supported, then you can end up servicing people in a really meaningful way that can kind of shoulder some of that risk that's inherently there with this population. So I never like talking about H4 without giving like a huge shout out to the team that's actually doing the work day to day. I get to sit in an office and present about the wins that my team is developing and fostering the relationships with every day. So they're doing the hard, like sweat equity, and I get to do the presentations to speak about the great work that they're doing. But I have tremendous respect for our frontline team that's delivering the services right now, and especially in the cold weather and in all of our communities across Ontario with the folks that are joining us. It's really challenging but rewarding work. So we're always happy to share any stories. If anyone's ever popping into Windsor and they want to come and see what we're doing, happy to give tours and share any lessons learned or any documents we've created so that other people have an easier time replicating something like this in their home community.
I'm actually coming at the end of the month, so maybe I'll give you a call, Whitney.
Yes, come on down.
Well, thank you so much. Thank you for your leadership. Thank you for sharing all of this incredible information. As we're seeing in the chat, it's really appreciated, and we're so happy to hear about the success of this program. So maybe with that, I'll turn it back over to Candace.
Awesome. Thanks so much, Sophia. And thank you, Whitney. Thank you both for this great discussion today. As Sophia said, the comments are just flowing in on the kudos, Whitney, for you and obviously the team that does this work. You know, I've heard about H4. This is probably my third time hearing a presentation. And every time I learn something new or there's been progress on what's happening. And I'm just so amazed by this work. And it's just so important, particularly for the justice involved population, and just breaking down that stigma and meeting people where they're at. And like you said, they're humans at the end of the day, and talking to folks in a different way makes a huge difference. So I really hope that others can take, you know, things from this model and are able to replicate it in their community because it's so important. But yeah, we just love hearing you speak about this every single time. And Sophia, thank you so much for facilitating that discussion. Your questions were so thoughtful and made me think about other things as well. And I think the attendees felt the same way. So that is the end of today's presentation, but I just wanted to remind everyone that this was part one of a part 3 series. And I believe Ali put in the chat that we have actually launched registration for our part 2, which will be Elizabeth Fry's modular housing project in Peterborough, Ontario. So if folks are interested in registering for part 2, you can do so now, and we'll also be sending something through our network. But thank you to all the attendees today for your excellent questions, your engagement, and we look forward to seeing you on the next one. Take care, everyone.
Thanks.
Thanks.
Bye.